Sounds good, Mark. Thank you very much. Turning now to the coronavirus here in Connecticut as the state prepares to distribute a vaccine. A lot of you have a lot of questions about it, and that's why we're here to help you get some answers. Joining me now is Dr. Virginia Bieluch, Chief of Infectious Diseases at the Hospital of Central Connecticut. Dr. Bieluch, thank you so much for being with us.
Great to be here, and hopefully I can help with the answers to some of these questions.
They're very good questions, and I think people want to do the right thing. They're concerned. They want to keep their families healthy, so let's get right to it. Health officials in the United Kingdom have said at least 2 people getting the shot suffered severe allergic reactions. So many of our viewers want to know, is it okay to get this vaccine if you do have severe allergies?
Well, I think we're waiting for further guidance on this. I'm sure this will be part of the FDA discussion tomorrow, and they will come out with some guidance in this area. From my understanding, the people who had these reactions had previously had reactions. There were people that had EpiPens, and vaccine centers need to be prepared for these types of reactions. Whenever you give a medication or a vaccination to a large number of people, a small percentage of them are probably going to have a reaction, and it's very important that the vaccine centers know what to expect and are prepared for this. And I understand that this is causing some concern, but I want people to focus on the number of lives that are going to be saved by this vaccination. And I'm sure every vaccine center will want to do this as safely as possible.
Makes a lot of sense. All right, this next question is from Deb in Glastonbury, and she wants to know, after getting the first of the 2 doses, do you need to quarantine?
It's a great question, Deb. Thanks for asking. No quarantine is necessary after you receive the vaccine. There are different types of vaccines being studied, and the ones that are coming available now are not live vaccines. The Pfizer and the Moderna products contain the code for our bodies to make an important protein that's part of the virus. Our body then raises an immune response to just that protein, and that is protective in the future. That immune response to that particular protein, called the spike protein, prevents the virus from causing infection. So you're not getting anywhere near a whole virus in these current vaccines. However, there are some people who have a reaction after the vaccine. And what that reaction is our immune system waking up and saying, hey, there's this thing that I don't recognize. I'm going to bring out the forces so that I can fight this off. And that's our immune system getting up, revving up to protect us from when we do really see the virus. You can get a little fever at that time. You may get some sore muscles, and you probably want to talk to your healthcare provider if that happens, just to make sure, because fevers, of course, can be an early finding in COVID-19 infection. But ordinarily, once you get the vaccine, you just go about your normal daily activities without worrying and being proud of yourself because you're working towards protection.
A lot of good information there. One more question for you before you go, and quickly here. Santa from East Hartford wants to know, after you do get the vaccine, should you still wear a mask in public?
That's a really great question, and the current answer is absolutely yes. The studies on the vaccines are looking at, do the vaccines prevent people from getting sick from the virus? And so they're measuring whether or not you get symptoms. The studies, a lot more studying needs to be done before we can throw our masks away, though. What we don't have the data on yet are whether or not you can still carry the virus in your nose but not get sick from it. And until we know the answer to that question is the vaccine prevents us from carrying the virus, we will all have to still wear masks. So I think we will eventually get these data. We will also eventually, hopefully, have enough people vaccinated that there will be few people that can get sick from this virus. But in the short run, the answer is save your masks and please wear them.
All right. So much good information there. We have so many more questions, so we'll have to have you back on again. But we appreciate everything, Dr. Bieluch. Thank you.
Anytime, Erin. Thank you.